Hi, I'm Dr. Steve Chi, and I've been exploring the mind body spirit connection for over 20 years. And there's something that doctors just don't explore with patients, and patients suffer so much as a result. And I just saw a patient recently, and this person had seen really so many doctors because of the medical conditions they have. And then they paused and said how she was feeling so dismissed by them because she was anxious, as if she was just making this all up, and that somehow she's crazy because she's still having symptoms and not getting better. And, for me, often what's really fascinating is what happens when I start to really validate their experience, validate their emotions, what's happening in the system, how they're not feeling heard, and then also introducing that their emotional dynamics could also be playing into their symptoms and vice versa, and that their symptoms could be causing emotional reactions. And I'm not saying, I tell this to people that, that this is just in their head and that that there isn't a physical manifestation to their symptom or their disease, but that simply that their emotions, which are in their body, could also be playing into this. And what's fascinating is that oftentimes it's like this avalanche of awareness for patients. And then they just start telling me things like, and I think part of it is because doctors often haven't explored this with them, but then there's just all this stuff they start revealing about what's happened, events that's happened to them in their past. And, for many of them, and whether we call it trauma or not, because, really it's a subjective term to the person, you know, people often have just an inherent wondering about the things that they've been going through emotionally in their lives and how that could be affecting their health. And I get the doctor's side in that, most doctors just don't like talking about it. They weren't trained to. It can take a ton of time for doctors from their perspective or feel like they can. And honestly, there's not a really good way of numerically evaluating it. I mean, there's no blood test or MRI for it. But the problem is that what I see is, you know, the emotional components or the emotional dynamics just get largely ignored and dismissed. And the challenging thing is the emotional dynamics could be playing into symptoms. And I've seen all kinds of symptoms, pain and other strange or medically unexplained symptoms being related to or caused by emotional dynamics inside. And sometimes it's both, that there is a physical, organic disease, and there's emotional dynamics contributing to symptoms as well. But the problem is the conversation is really only about addressing it physically. And that's where, as patients, it's important to be educated. You know, Bessel van der Kolk has written a great book called The Body Keeps the Score. Gabor Mate has written a book called When the Body Says No. And there's other books as well. And, from my perspective, it's important to address this both ways. Address this on the physical level with your doctor, but also address this on the emotional level too. And there are many body based psychotherapies out there. Personally, I'm a fan of internal family systems, but there are other body based approaches that can help you to start exploring the emotional content of what's happening too. And I bring this up because often what I see happen is this: there's something going on in the body. The doctors can't figure it out, or the physical based approaches don't seem to completely help, or only temporarily, or only to a certain extent. And people keep looking. They're looking for a physical level answer, and they don't really explore the emotional side to it at all. And that to me is really where there could be a lot of unnecessary suffering amongst patients. So if you like this, feel free to subscribe or comment below. Thanks so much.